Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is causes and risk factors in developing illness. Causes is also known as etiology. Okay, illness, disease or sickness can develop with or due to a number of or various causes or various risk factors. Illnesses can develop due to a combination of a group of causes and risk factors. These risk factors may be genetic, may be environmental, may be lifestyle related or due to any infectious agents such as bacteria, virus, fungus, protozoa or other parasite, etc. The factors may be either genetic or environmental or lifestyle and behavioral practice of the person related or due to various infectious agents. The major causes or main causes and risk factors in developing illness are classified into 9 factors, or 9 etiological factors or causes. First is genetic factors. Second one is environmental factors. Third one is lifestyle and behavioral factors of the particular person or individual. And fourth is the infectious agents. Then fifth one is chronic stress and mental health condition of the person or a particular individual. Chronic stress and mental health condition of the person. Then sixth one is age and gender. Age of the person and gender of the person. Seventh one is socio-economic and cultural factors. That includes socio-economic status of the person and cultural practices. Various tradition and cultural practices. Then eighth one is comorbidities. So morbidity is nothing but the term used as synonym of disease. So the previous or past diseases will lead to the secondary infection and secondary diseases. That is comorbidities. And ninth factor is medication and or medications and medical treatments. So overdose of medication also may cause certain problems or illness. That is medications and medical treatments also can lead to infection. The last one is 10th one is others. There are many other combination of various factors which can cause or which can be an etiological factors for causing diseases. So let us discuss in detail about all these 10 factors which cause a disease. First one is genetic factors. In that first is heredity. Some illness or some illnesses or disease such as heart diseases, cancer and diabetes mellitus have a genetic components that can be passed down through families. So from parents to children. So some of the diseases from the parents can be genetically transmitted through chromosome or genes to the children. For example, if the parents is having diabetes mellitus, if both the parents are having diabetes mellitus, 99.9% chances are there the children to have or to get the diabetes in future. So that is through heredity nature. Thus some of the illness such as heart diseases, cancer, diabetes, etc. can transfer or the children may be inherited from their parents. Under genetic factors, second factor is gene mutations, mutation of the gene. That is nothing but structural or genetic changes, structural changes of the gene. Mutations in genes can increase the risk of developing certain conditions or certain diseases such as cystic fibrosis, certain type of cancers. These all can be occur due to the mutation, genetic changes or mutation of the genes. So these are the two factors comes under genetic factors. Next is environmental factors. In that first one is exposure to various toxins from the environment. Chemicals, pollutants and radiations can cause illness like cancer, respiratory diseases or illness and even skin allergies or skin conditions. So exposure to various chemicals in the factory or in the work setting or from the environment or pollutants, different pollutants, air pollutants and radiation from various rays can cause illness like cancer, respiratory diseases and skin allergy and skin conditions. Second is occupational hazards. The various risk factors in the occupational setting or work setting. So working in environment with harmful substances such as asbestos, silicose, heavy metals like lead and its dust, different type of dust, increases the risk of diseases like asbestosis. Okay, so inhalation of the asbestos dust for a prolonged period will lead to respiratory diseases, that is called asbestosis. Okay, inhalation can cause various lung cancers and pneumoconiosis. Okay, and exposure to for a prolonged period to heavy metals that may lead to lead poisoning. Okay. Third environmental factor is climate and geography. Climate, weather condition and geography of the particular place, okay, or the locality, okay, or the area. Certain areas may have higher prevalence. Prevalence means occurrence of a particular disease. Higher prevalence of disease due to environmental conditions such as malaria can be seen most commonly in the tropical regions. Okay, in the tropical regions, malaria's incidence are more, or malaria is endemic in tropical regions. Then seasonal infections such as seasonal flu, okay, could be seen in the winter season. Okay, or summer season we have many different type of summer related infections, okay, and problems, health problems. So seasonal infections such as summer and winter season have different type of health problems. Even hepatitis A or viral jaundice could be seen in both in summer season and winter season. Okay, so these are the three factors comes under environmental factors which cause a particular disease. Next is lifestyle and behavioral factors of a particular individual, which includes diet, preference of diet, physical inactivity or irregular exercise program, smoking and alcohol use, and drugs or substance use, different substance use. So first one is diet. Poor nutrition or lack of adequate energy and calorie or protein, carbohydrate, fat, etc. can cause some particular deficiencies, okay, or excessive intakes more than what is required, okay, excessive calorie, okay, of certain foods can lead to obesity, heart diseases, type 2 diabetes mellitus or lifestyle disorders, okay, then certain cancers. So poor nutrition can lead to various deficiencies, okay, that is such as PM, protein energy malnutrition, vitamin deficiencies, okay, like scurvy, rickets, etc. And excessive intake can lead to obesity, heart diseases, type 2 diabetes, etc. and even certain cancers. Second factor is physical inactivity of the persons. So following sedentary lifestyles, okay, without regular exercise, without adequate rest, okay, and consumption of the junk foods, etc. increase the risk for various cardiovascular diseases and even obesity and metabolic disorders and metabolic syndrome, okay, and hormonal variations, so that related problems, etc. Okay, that is comes under physical inactivity of the person. Then smoking and alcohol use. So tobacco use is linked with various cancers, especially lung cancer, throat cancer or mouth cancer or oral cancer, etc. Even that can lead to various cardiovascular diseases and respiratory illness due to inhalation or consumption of various tobacco products. Example is cigarette smoking and BD smoking, etc. Then excessive alcohol intake or alcohol consumption can also cause various liver diseases such as cirrhosis liver, and a person may become addiction to the alcohol, okay, alcohol addiction, and other systemic issues with the various systems, involvement of various systems in the body due to excessive alcohol intake. Then regarding drug use. So various substance abuse can result in both physical and mental health issues. The example for physical issues are liver failure, various infections, okay, infection even from using drug with the syringe, that is from intravenous drug use by the drug addicts, and even cognitive or mental disorders or intelligent based disorders, okay. So both mental and physical problem could happen due to various substance abuse. Then fourth main factor is infectious agents. So there are various infectious agents. These infectious agents otherwise known as pathogenic organism, okay. For example, bacteria and viruses. So first one is bacteria and viruses. Infectious disease like flu, tuberculosis, HIV or AIDS and even COVID-19 corona are all caused by various pathogens or microorganisms which cause the particular problem. Then example for bacterial infection may strep throat, pneumonia, etc. These are the example for bacterial infections. Then example for the viral infections such as hepatitis A, influenza, etc. Okay. Now second is the parasites and fungi. Okay. There are many parasitic diseases such as malaria, protozoal diseases, okay, malaria, and even fungal infections such as candidiasis, histoplasmosis are also common cause of certain illness. Okay, you can see that example for histoplasmosis, and this is oral candidiasis. Okay, so parasitic disease or protozoal disease such as malaria and fungal infections such as candidiasis and other skin infections. Okay, fungal infections. So these are the infectious agents that is caused different type of disease in a human being. The fifth factor or cause for illness is chronic stress and mental health of the or mental health condition of the person. In that first one is stress and anxiety. So chronic stress or continuous stress weakens our immune system. Okay, that disturb our resistance power and immune system. That indirectly increase the likelihood of certain illnesses because of the reduced or weakened immune system. Then this is also associated with certain heart diseases, digestive problems, and even mental health disorders like depression, etc. Okay, due to chronic stress and anxiety in the various situations in the life can lead to many physical and mental problems. Then mental illnesses or mental diseases such as depression, bipolar disorder, that is mania, and schizophrenia all may increase the susceptibility of the person to have physical illness and it negatively impact overall health of the persons. Okay, so there are many mental illness such as depression, bipolar disorder or mania. You could have seen that some people in the roadside they are talking loudly. Okay, and they are laughing loudly. Okay, such cases are we call a manic patient. They may have extreme mood and elevation of mood. Depression means they won't react, they won't do their basic activities. They are more sad and loneliness. And schizophrenia is other form of disorders which is a part of the mental illness. All this have increased the proneness or susceptibility to have various physical issues, and that may indirectly affect the overall health of the persons. So these are the two factors under chronic stress and mental conditions, health conditions. The next important factors are age and gender of a person. Certain illnesses are more common in certain specific age groups. Okay. For example, you know that Alzheimer's disease are common in old age people. Okay. Then chickenpox are common in children. Moreover, as people age, they become more susceptible to have more chronic diseases such as arthritis, joint pain, heart diseases, dementia, that is cognitive disorder, that is mentally related, and cognitive disorder, that is dementia, etc. could be seen in the aged people. Okay, that means the person is prone to have certain diseases during certain age period. Okay, childhood and even in adolescence. Okay, at puberty, in old age, etc. like that. Okay, that is the how age factor influence the or cause various illness. Now second is gender. Men and women may have prone to different type of illness due to hormonal influences, due to physiological function, and even due to their behavioral differences. So hormonal differences are there in men and women, and the physiological difference and the behavioral difference are there. This will cause different type of diseases in both male and female. For instance, women are more likely to develop osteoporosis in the old age, while men have higher risk for the heart diseases in earlier life. Okay, so women are more prone to have osteoporosis, and moreover, women are more prone to have certain diseases during puberty. Okay, during antenatal period, postnatal period, during menopause, etc. Okay, the seventh factor is socio-economic background of the person and cultural factors or practices. Socio-economic and cultural factors. In that, income and access to health care. So lack of access to adequate health care and living in poverty, that is below poverty line, are major risk factor for developing certain illness, particularly for preventable diseases. So there are many preventable diseases that can be prevented by taking such many measures. For example, having vaccination to prevent vaccine preventable diseases. But lack of access, lack of availability or affordability of the healthcare services or government healthcare services at free of cost may lead to certain problems and illness. Okay. And if the person is below poverty line, he may not access the health services from the private sector. Okay. That also will lead to number of diseases or illness. So this is about income and access to health care, how it acts as a factor to influence or cause various illness. The second sub-factor is cultural practices and behavior of the persons. So certain cultural or societal habit, okay, such as dietary customs, female genital mutilation. Female genital mutilation, FGM, is nothing but cutting or removing of some or all the part of the vulva. There is a procedure involved partial or total removal of the external female genitalia. It's a cultural practice, okay, in certain community. Also bad cultural practices, okay, unscientific cultural practices and societal habits of the people, etc. all can lead to or contribute to various illness or diseases. Then eighth major factor is comorbidities. Okay, comorbidities. Morbidity is nothing but disease condition only. In that, first factor is pre-existing conditions. So people with the chronic diseases, people is already having certain diseases that is chronic in nature, like diabetes, hypertension, are at high risk for developing other secondary health complications or additional health complications such as kidney diseases. So later they may have kidney related diseases, chronic kidney diseases, CKD, and even they are very prone to have a heart attack. Okay, that is a pre-existing condition, also lead to secondary infections and diseases. Okay, that comes under comorbidities in that pre-existing disease conditions. Then second is weakened immune system due to chronic diseases or comorbidities. So immunocompromised individual, that is nothing but people, they are lack or weakened their immune system due to some diseases, that is called immunocompromised individual, such as person with HIV or AIDS. Okay, or people go for chemotherapy due to cancer. All are become immunocompromised individual. They are more prone to or more susceptible to have certain infections and other diseases and illness. Okay, this is about a weakened immune system. So these two factors comes under comorbidities which cause certain diseases. The ninth factor is medications and medical treatments. Taking certain medications or undergoing certain medical treatments also can cause various illness and diseases in human being. First one is side effects and overuse of the medications. So some medications have side effects. Not some, almost all medications having side effects. That may lead to additional health issues or additional health problems. For example, regular or continuous use of antibiotics may lead to antibiotic resistance. Okay. The reason is microorganism will get resistance against that particular antibiotic. Okay. So the use of regular medications such as antibiotic may cause resistance, and that may lead to different health problems, or person could not treat with the same particular diseases. Okay. Then overuse or misuse of medication. Unnecessarily people may use or people may consume a lot of medications. Okay, that is overuse or misuse of medication can also increase the risk for various health problems. Sometimes people may prefer to have the medication from the medical shop without getting the prescription from the doctor. Okay, so these all lead to certain medication related health problems. Next is surgical complications. So person who undergo certain surgical procedures, okay, or invasive procedures. Invasive procedure is nothing but some procedure done in medically that is inside the human being. Okay, that is invasive procedures can increase the risk of certain infections. Okay, if it is not sterile, if the articles are not get complete sterile, then that may cause not only infection but also lot of complications, particularly in high risk patients. High risk patients are the patient they are prone to get a lot of problems due to chronic diseases. Okay, So far we have discussed about the major causes and risk factors of developing illness. There are 9 important factors and there are many other factors which can cause diseases in human being. So now let us summarize the topic, that is main causes and risk factors in developing illness. So there are mainly 9 factors and other factors. So first main factor is genetic factors, which includes heredity and gene mutation. Second is environmental factors, which includes exposure to toxins, occupational hazards and climate and geography of the area. Third main factor is lifestyle and behavioral factors, which include diet, physical activity, smoking, alcohol, substance abuse or substance use. Fourth main factor or major factor is infectious agents, that is bacteria and viruses and parasites and fungi. Fifth major factor is chronic stress and mental health, which includes stress and anxiety, mental illness or condition of the person. Then sixth one is age and gender, which includes age factor and gender factor. Seventh one is socioeconomic and cultural factors, which include income and access to healthcare and cultural practices and societal habitation. Eighth one is comorbidities, that is pre-existing conditions and weakened immune system of the person. Ninth factor is medications and medical treatments, which includes side effects and overuse of the medications, then surgical complications. Then like that there are many other factors which influence or cause various illnesses and diseases in the human being. So hope this video really benefits in your studies and exam. If you feel it is really worth, please like, share and subscribe my channel and stay tuned with the Angel Health Academy for the next academic video. Thank you.